Hello, welcome to my office. My name is David Moskowitz, and I am a board-certified internist and nephrologist, in other words, kidney doctor. And I'd like to tell you today about my protocol for keeping 90% of patients with chronic kidney disease off of dialysis. Kidney disease is measured by a blood test, the serum creatinine, and a formula converts serum creatinine, which is a lot like cholesterol. You have to know your number, and it's in every lab test that you get. The formula converts your serum creatinine into a measure of your kidney function called your estimated glomerular filtration rate, or E for estimated GFR. The eGFR ranges from a number about 100 or so, or even higher, down to a number of 1. People go on dialysis when their number gets very low, around 5. And what I like to do is keep people with an eGFR above 60. If I can keep you with your eGFR above 60, then you'll never need to go on dialysis. So how have I been doing this for the past 30 years? By using an ACE inhibitor, a blood pressure pill called quinapril. Unfortunately, quinapril is now out of availability. I'm the only person who has availability access to quinapril. And so it's the only way that I know of to stay off dialysis. Quinapril is uniquely able to prevent kidney failure, as I've proven in the past 30 years with about 4,000 patients, the first 1,000 of which were published in 2002. Since then, I've acquired another 3,000 patients, the most famous of which has been off dialysis, has been kept off dialysis since June of 2018, so over 6 years now. The secret is taking a large dose, larger than conventional dose of quinapril, and controlling serum potassium with a second drug called Florinef, or fludrocortisone acetate. These drugs are safe. I haven't had an adverse event in 30 years and in over 4,000 patients. They work in African Americans, Haitians, Hispanics, whites, basically every population that I've tried them in. There are only 2 caveats. One is a cough that is common to all ACE inhibitors. 1 in 10 patients given an ACE inhibitor get a cough, which people can find a nuisance, and that can cause them to stop the ACE inhibitor. If you stop the quinapril, I can't keep you off dialysis. So some patients who are close to dialysis, I try to give cough syrup to so that they can suppress the cough and still stay off the machine, which they and I both feel is more important than coughing. The second warning about ACE inhibitors is that about 1 in 100 patients who take them can get swelling of their throat, so-called angioedema. It manifests first usually as a swelling of the lips or swelling of the tongue, and it can be associated with tightening of the throat, tightening of the airway, and inability to breathe. This is an emergency and requires a visit to the emergency room and treatment for anaphylaxis with an epinephrine pen. And people who get angioedema, as it's called, from an ACE inhibitor should never take an ACE inhibitor again. But I have not had that severe a reaction on quinapril in 30 years. And so it's very unlikely. On the other hand, dialysis claims 120,000 Americans every year, 3 times more people of color than whites, and about 20 times that number worldwide. Dialysis is a grim diagnosis. Death occurs usually within 2 to 3 years. It's a worse diagnosis than cancer. And the only way out is to get a kidney transplant, which currently doesn't happen for most people. There are only about 20,000 cadaver kidneys from deceased people available per year, plus living donors. And given that there are 125,000 people every year who need a kidney, and there are 500,000 people on dialysis who are waiting for a kidney, your chances of getting a kidney are very small. And very reasonably, they're given to young patients who are in good health, not to elderly patients who have heart disease and lung disease. Generally, if you're an older person and you go on dialysis, you're not going to get a kidney. All the more reason to prevent going on dialysis in the first place. So please do contact me. Go to my website, genomed.com, GENOMED.com, and on the upper left-hand side, click on Contact Us. Give me your email address or your cell phone if you don't have one, and I'll contact you back and send you a questionnaire to see if we could work together productively. Thanks so much for your attention, and I look forward to working with you soon. Goodbye.